Okay, so what is your name and position? My name is Omar Haddo. I am a consultant orthopedic surgeon, and I'm based in London. Yeah, so pretty much what made me go into orthopedics and more so into shoulder and elbow surgery is the mentors that I had during my training. So starting from very early days in medical schools, certainly here in England, you rotate between different subspecialties and you have a short time exposure to it. And in those, you meet certain consultants that inspire you. And for me, it was very much orthopedics from very, very early days of my medical career. And then in that, once I've chosen orthopedics and I went through the training for orthopedic surgery, I met fantastic surgeons in shoulder and elbow surgery, which made me then subspecialize in that. So where did you grow up? I grew up in Baghdad in Iraq. I was born there and my family are all from there. And I was there until the age of 12. So I was still at school, and it's at that time that then we moved to England, and I've been here since then. So what do I find most rewarding about my job? I think the most rewarding aspect of my job is the patient satisfaction. So seeing a patient that comes back to clinic or sends a little postcard or something like that to say they are extremely pleased with what I've done and it's given them their arm back, the use of their arm back or their life back and everything. I think that's the bit I find the most satisfying. The next most satisfying thing in my job is the aspect of training junior doctors. It's absolute pleasure to have juniors from any grade and to teach them and sort of seeing them sort of grow and develop into the post and hopefully eventually become very good doctors, surgeons, whatever they choose in their careers. What do patients value most about me? That's obviously a difficult one for me to answer, but I think the one thing I get as a feedback is the communication. It's giving them time, listening to them, explaining to them what's wrong with them and what we can do about it. And I think that's the one thing they value most. I hope, and I'm sure they value my surgical skills and things, but really the one big feedback you get is how much they got out of the consultation in particular and how much they now understand a lot more about their condition. So I think that's what they value about me. Now, what do I value about my patient? I think, especially in today's time, I really value their patience. I value their understanding because we are going with COVID and everything. It was very turbulent time in terms of sometimes, yes, we can operate, then we can't operate, then we can see patients face to face, then we can't see them face to face. And I think I've been very fortunate, and I hope my patients feel that as well. But I think that's my answer to that question. So what are the challenges of my specialization? Very good. I think for any specialization, things are always moving with the times. Things are progressing. New techniques come out. New instruments come out. Robotics, virtual, and so on. And that is challenging, but also very, very enjoyable and rewarding. It's I think keeping up is the best answer. Keeping up with the times and keeping up with everything. There's always challenges on a day-to-day basis, management issues in terms of managing your time, managing your lists and everything. But that's certainly very bearable and becomes more of a routine rather than anything else. How do I behave in frustrating, difficult and stressful situations? Very good question. Maybe my response to that would be very different to what others around me feel. I think the best way is I can say that has changed a lot. Certainly in my younger days, I used to get very, very frustrated in a stressful situation. And maybe back then I behaved with it badly. At the moment, I think the best thing I can say and I can tell you I've learned is to take things calmly, to maybe walk away from a stressful situation, and don't rush into dealing with a difficult or stressful situation. Certainly take time out, think about it, and reply. So one technique now, if there's a frustrating, for example, email, I write a reply, but I don't send it. I save it and I read it a day or two later and then decide to send it. So that's like a new technique that I've sort of taught myself to do, and so on with actual confrontational or face-to-face stressful situations. Oh, adjective to describe my profession. I think my profession is highly rewarding. So rewarding I'd use as one of them, and extremely enjoyable. The job is kind of the best. I wouldn't change it. I wouldn't change anything if I had to start all over again. Yeah, those are my two adjectives. I couldn't add any more.